Good evening, everyone. Thank you for sticking with us till the end. I'm really honored to be closing us out and appreciate I'm standing between us and happy hour. So I appreciate your attention for the next 7 minutes. So as Liz mentioned, I am currently a strategy director at Blue Cross Blue Shield. I have a background in consulting and at startups. For the last 5 years, I've focused on value-based care. It's something I'm very passionate about and I believe has the potential to really transform healthcare. So I'm going to tell you what value-based care is. If you are in healthcare, you've at least heard of it, or you might know something about it. I'm going to tell you why you should invest in value-based care companies, how to invest strategically, and then leave you with some next steps and things to think about. So number one, what is value-based care? All right, let's start with the problem. We know the US healthcare system is fundamentally flawed. We spend more than any other peer nation as a percent of our GDP and per capita. We are continuing to spend more. Costs are rising, and we don't get anything better for what we are spending. Outcomes are worse by both life expectancy and overall morbidity. A big reason why this is because our healthcare system is built on fee-for-service, which means a doctor is paid for delivering you more care, not necessarily better care. Whereas value-based care, on the other hand, actually rewards providers for delivering better outcomes and more efficient outcomes. I am trying to simplify what can be a very complicated topic and concept, but in its simplest terms, it puts fees at risk. And so a provider is only paid or they're paid extra if they achieve strong outcomes, not just for delivering more care. You can think of this like a contract that only pays out if certain project targets are met, a professional athlete who gets a performance bonus for a great season, or a GP who earns 20% carried on top of management. That 2% is going to be pretty good, but their actual sort of overall incentive is going to be based on how well they pick and how well their portfolio companies perform. All right, that's value-based care. Why should you consider investing in value-based care companies? Value-based care is projected to be 75% of all healthcare spending by 2030. It's a pretty significant number. Healthcare spending will be $7 trillion in the United States only by 2030. And in the next 3 years, value-based care assets are projected to be worth $1 trillion. So not only is the market growing, but valuations are high. And I'll talk to you about exit potential in just a minute. There's a lot of drivers for this. We see value-based care driving a significant portion of healthcare startups. Providers are asking for it. You can see 80% of PCPs are interested in value-based care because they see 75% of their revenue is going to be tied to value-based care in the next 5 years. And employers are really interested in this. Healthcare is the single largest line item in most companies' P&L, and so they want to find a way to sustainably address cost and have better outcomes for their employees. So a couple examples I want to highlight in terms of value-based care companies. Even if you're not in healthcare, you probably recognize a couple of these companies. We see pretty high valuations either through IPOs or through actual acquisition by both either payers or large providers as these companies want to have a bigger handle and performance in value-based care contracts. So I've told you what it is. I told you why you should consider investing. And now I'm going to help you think about how to invest strategically because not all value-based care companies are created equally. The ones that Liz worked at, I'm sure were stellar, but they're not, some of them don't necessarily perform well. And you want to make sure you're identifying the right ones. All right. 2 main things I want to emphasize before we get into my investing framework. Number 1, who buys healthcare and who uses healthcare are different. And number 2, a value-based care company's overall performance is based on how well they actually deliver outcomes and value. So number 1, the purchaser can be your employer, it can be a payer, or it could actually be a provider or a hospital. And that is going to be different than the user, the patient, the consumer, or the employee. And a lot of startups that I've talked to as a mentor through Matter and through my work at Blue Cross Blue Shield fundamentally don't understand the distinction between the two. And a successful startup needs to be able to sell to both the payer and who is actually using their product. They need a sales cycle and strategy and uptake on both sides. And then on the other side, one thing I see a lot of value-based care companies misunderstand is their product market fit and how what they do actually drives outcomes. They need to have a really crisp understanding how their intervention creates financial and or cost savings, or clinical savings. Keep in mind, the biggest question to ask if you're evaluating a value-based care company is, can they bend the cost curve? That should always be top of mind. Beyond that, you need to start looking at these 4 different criteria. The first 2 are table stakes, and I see the second 2 as what are key drivers of success. Number 1, robust clinical model, and this is true in any healthcare company. The fundamentals have to be there, and they have to have a fundamentally strong understanding of how their product interacts with the patient journey. You need to see that they have really strong clinical leadership and a plan to not only develop a clear clinical model, but also continually manage that. As healthcare and medicine continues to change and our incentives continue to change, they need to make sure they're continually being managed. Number two, technology and analytics. I think of this in two parts. That's tech, the underlying software and data, and the analytics, which is the insights. We have a plethora of healthcare data, but a dearth of healthcare understanding and insights based on that data. So companies do need to be able to access, have really strong tech systems, understand clinical validation of data, be able to access EMR, all sorts of information, but then be able to turn that into action-oriented insights at the patient, contract, population, and business level. So not only can providers change their behavior, but an overall value-based care company can change, see where their contracts are performing well and where they're falling behind, because that's really what's going to drive their overall revenue and P&L at the end of the day. All right, drivers of success. So clarity on product and market offering. This goes back to the point I was making on the previous slide. So value proposition, what is the ROI? I've talked to companies who give me an N of 20, and that's not relevant information. That N is too low. I can't really make a decision on millions of dollars with such low use case. So you need to have a really clear ROI and really strong long-term potential to see what that financial impact is going to be. And then market alignment. Again, companies don't necessarily understand who they're selling to and how that's different from who's using it. And so really helping to suss out if this company has a dual pathway understanding of those two different parts of the market. And that will be things like willingness to buy. That will also be things like willingness to use. All right, growth plan. This is something I really learned a lot through Capita 3. They have been great partners with me for the last 4 months. Growth plan, I think, really lies on who you're investing in. That is the leadership, because a good idea is not just enough. We've talked to several companies who have great ideas, but then the question is, all right, what's the long-term plan? And can the leader execute on that? Healthcare is extraordinarily complicated and it's tricky. And you need to know that the leader you're investing in understands the complexities and intricacies of the healthcare landscape to execute successfully. The last piece I also want to highlight is adjacencies. As value-based care moves more into specialty areas, you need to see a company has an expansion plan beyond just obesity, beyond just behavioral health, beyond just long COVID. As Ibrahim pointed out earlier, there's so much long-term potential beyond just one clinical area. And so seeing a company has potential to expand is going to be really important. So I have a full diligence checklist across all of these different categories that I would love to leave you with at the end of my presentation. I also have more slides that I didn't have time to get to, but the last few thoughts I want to leave you with are where the market's going. Historically, it's been in primary care, and it's going to move to specialty. Historically, it's been in Medicare Advantage, and we're going to see more in commercial. But these two places are harder to perform in, and they're less proven. And so really digging into the fundamentals of the business are going to be really critical. And then the last is being aware of industry factors. If you're new to healthcare, it's a really long exit potential and really long time horizon. That's just the nature of the game, and being comfortable, that's important. So if you are interested, you can scan this QR code. You will find a more detailed version of this deck. You will find some explainers on BBC, analyst reports, and investing resources. I also wrote a few blog posts through my time with Capita 3, so I have those up there as well. And the full diligence checklist that I mentioned. My email will also be in that QR code if you want to reach out to learn more. Thank you very much. I appreciate your time.